Are you the parent of a baby who suffered a brachial plexus injury at birth? Then only you know the terror of being discharged from the maternity ward with your baby, unable to move their arm. That's right, that feeling of guilt and anger you have during the hospital stay gives way to a feeling of doubt. What should I expect from now on? Guys, a brachial plexus injury in a baby is different from a brachial plexus injury in an adult. A brachial plexus injury in an adult usually happens when the patient is thrown from a motorcycle, for example. Most of the time it's a motorcycle, and they hit an obstacle, and their arm is pulled downward with a very intense force dissipated all at once in the shoulder in just a millisecond. That's why the injury in adults is more severe. It causes avulsion, it damages the nerves more, and in the vast majority of cases, it requires surgery. In babies, the injury happens over a longer period and with less force. In other words, when the baby's arm is being pulled during birth, it's not a single strong yank in a split second. So it's very rare to have avulsions or ruptures. That's why more than 80% of brachial plexus injuries in newborns improve without surgery. So that's good news for you from now on. Don't compare brachial plexus injuries in adults with those in children. Adults experience a lot of pain, it's a much more severe injury, and there is much more atrophy. Babies have fewer avulsions, less muscle atrophy, and usually the movements of the arm start to improve as early as the first or second week after the injury. However, there are indeed those 20% of cases where the injury is more severe and will require surgical treatment. How do you tell the difference? For example, if your baby has no movement in their hand and is already approaching 3 months old and still has no hand movement at all, then surgery is needed. If the baby is moving their hand, but by 6 months still has no movement in the elbow, meaning there is no biceps movement, that is another indication for surgery. And if at 9 months they can't hold, say, a piece of cookie and bring it to their mouth, that's another indication for surgery. If they pass each of these stages at 3, 6, and 9 months, there is a great chance they won't need any kind of procedure. Understand this, I'm not talking about whether or not to do physical therapy. I'm talking about whether or not to operate. Physical therapy is extremely important, regardless of the situation. If you liked this video and it clarified a lot for you, you probably noticed that there isn't much content about this topic here nowadays. So don't forget to like the video and follow our channel.